I'm Dr. Margaret Lafferty, live from the 2017 Hot Topics in Neonatology meeting in Washington, D.C. I'm here with Dr. William Tarnow-Mordi, and we are here to discuss his talk on cord clamping. Welcome, Dr. Tarnow-Mordi.
Thanks very much.
Absolutely. Thank you for being here. Dr. Tarnow-Mordi, can you tell us what was the main objective of your talk?
The main objective was to review the implications of a trial, which is called the Australian Placental Transfusion Study, which is published online in the New England Journal of Medicine on the 29th of October, but also to review the implications of a systematic review of all the trials that we could identify of delayed versus early cord clamping in preterm babies, which included the Australian trial. And that was published online in the American Journal of Obstetrics and Gynecology on the 30th of October. And both of them are open access and freely available.
That's great. Can you tell us about the Australian trial? Tell us about the design of that study.
Sure. Well, this is a randomized controlled trial, a pragmatic real-world study, which set out to answer the question in preterm babies born before 30 weeks gestation. If you delay clamping the cord for 60 seconds or more, compared with the policy of clamping the cord within 10 seconds of delivery of the baby, is that going to reduce the incidence of the adverse outcome of death or major morbidity? And major morbidity was made up of chronic lung disease, necrotizing enterocolitis, sepsis, brain injury, and severe retinopathy.
What a great objective. Can you tell us how that study was designed?
It was designed as a randomized pragmatic trial. We did a pilot study to begin with, and that's described in the journal article. And as a result of the pilot study, we decided to keep it simple and not to try to assess the effects of cord milking in the Australian placental transfusion study.
And how many babies did you randomize?
Well, we aimed for 1,600 babies randomized before 30 weeks gestation as fetuses, and in fact we ended up with 1,566 babies. So that made it the largest trial of its kind. But even that wasn't large enough to definitively answer all the questions we wanted, and that's why we decided to update the systematic review by including all the trials we could find, and that's the substance of the second study that was published a day later.
Absolutely. Tell us about the results of that first study.
Well, the results of the first study was that the primary outcome, which is the composite of death and major morbidity, showed no difference between the two policies of immediate clamping and delayed clamping. Which was a disappointment. However, there were a number of secondary outcomes, and for us the key secondary outcome was death at 36 weeks postmenstrual age. And of all the 10 secondary outcomes that we published, that was the only one that showed a significant reduction with delayed clamping. Now, that could have been a type 1 error because there were at least 13 secondary outcomes that we pre-specified. And so the journal insisted that we do not overread and overinterpret that finding, that secondary finding. So we published it as an interesting finding that required clarification with an updated systematic review. And we were able to have a rapid review of the systematic review published in the Obstetrics and Gynecology Journal of AGAOG, and that came out 24 hours later. And that included 2,834 babies born before 37 weeks gestation. And that showed beyond much doubt that there really was a real effect of delayed clamping. And what it showed was that in the nearly 3,000 babies in those trials, there was a third reduction, a 32% reduction in hospital mortality associated with the policy of delayed cord clamping compared with immediate clamping.
That's great, thank you. What would you say is your overall takeaway point for the audience?
The overall takeaway point is that it's taking us far too long to do these kinds of studies. The APTS study took 10 years. It's 30 years since the first trial of delayed versus immediate clamping. Seems a simple question to answer, but it's taken us 30 years, and even then, only 3,000 babies. During that time, 450 million preterm babies were born. So the take-home message is, can we do better than this? And can we join together and start to do some mega trials in which we aim for sample sizes much, much larger than has previously been the norm? By mega trial, I mean 5,000 babies at least. And can we set our sights high and start to aim for trials with 10,000, 15,000, 20,000, and have them overseen by a single data and safety monitoring committee, so that if necessary we can stop early, but that we can go and get large numbers recruited very quickly and very simply. And we've been invited to submit an editorial to Pediatric Research outlining the aims of this new collaboration, which we call the Alpha collaboration. And we'd like to invite everyone who was present at Hot Topics to contribute and to endorse that editorial commentary. So we'll be contacting everybody about that.
Sounds good. Thanks very much, Dr. Tarnow-Mordi.
Thank you very much.
That's a wrap for us here at the 2017 Hot Topics in Neonatology meeting in Washington, D.C.